Wow. So I have a daily headache. One very interesting symptom I have is facial spasms when I have the headache. It really just destroyed everything in my life, like no work, no social life, nothing. I think I'm on the 4th medication at this point. Oh my God, it feels better. Relieving different parts of my body and just feeling better is just confirming that this could be it.
You're coming from Canada. What part of Canada?
GTA, so very close to Toronto.
Okay, great.
Yeah.
Maple Leafs fan?
Not very much, soccer guy.
Oh, soccer. Okay, gotcha.
Yeah.
But man, I thank you guys for coming all this way. You guys saw us on YouTube, so tell me what's going on with you, what's bothering you, what's hurting you, everything.
So I have a daily headache.
Oh wow, okay.
It really just destroyed everything in my life, like no work, no social life, nothing. It's also accompanied with stiff muscles, especially neck and lower back, and fatigue. I'm extremely tired on a daily basis. But the headache is, I would say, the core of the problem. More specifically, I have pain behind my eyes. The really worst part is when I wake up in the morning. That's the worst. And it comes back when I get tired.
Wow.
Yeah. So I've been to neurologists. Sleep clinic said there's nothing much. Neurologist gave me a couple of different, I think I'm on the 4th medication at this point.
Oh my gosh.
And nothing much. Actually, one very interesting symptom I have is facial spasms when I have the headache. But when the pain is really strong behind my eyes, I feel like doing this is the natural thing.
Yeah.
And my face does this.
Do you have that recording?
Yeah.
Can I see that?
Yep, there you go. This is today in the morning. So today is one of my bad days.
Oh wow, okay.
Usually, there's good days, there's bad days. Today is a bad day.
Wow. How long has this been going on for now?
It was on stages, and I feel like it spiraled like out of control after a period of stress. After a period of stress, I started getting depersonalization, and then the phase after that was the daily really, really bad headaches. So this has been for the past 2 years.
Wow.
The year before it was like all the depersonalization and all that. But the 3 past years were, let's say, really bad. This is when I had to step out of work.
So it's really just like taken over your life.
Everything.
Completely.
Yeah.
How are you feeling? I mean, obviously this is taking a mental toll as well too. Like, how are you feeling mentally with now all of this? Like, I mean, do you feel like hopeless? Like,
No.
Like, what's going on? Like,
I feel very hopeful. So first of all, I believe that God is all looking, all capable, and I'm His servant, and He will heal me.
Yeah.
So that's first of all. Second is, I definitely feel like I'm getting better.
Good.
So medications, maybe they're not doing much, but very slowly getting better. I feel like I'm thinking about it more better. Accepting it. I used to just get panicky when I get it and I have something to do. Like, how can I go to this meeting while I'm in this much pain? Now it's much better. I was like, okay, I'm just accepting that it's painful, but I will be honest with people, telling them I'm tired. I'll do my best. So mentally, I feel like I'm getting better. Physically, slowly, not as fast, but
well, let's accelerate that today, yeah?
Sounds good.
Yeah. I mean, the way that you've just described it, you know, for somebody that has told me like it's completely ransacked their life, you know, I don't know the complete extent of it, but it seems like you've had to change jobs.
No, they were really nice, and they accepted that I stepped out for a little bit, and then came back, and then I'm on part-time right now.
Okay. We want to make sure that it doesn't get past what it is right now. The fact that you've been having daily headaches for the past couple of years, and they turn into migraines too, and then you have these facial spasms, that's crazy. But a lot of it, when you're telling me it's right behind your eyes, and you're telling me like a lot of it's coming from and through here in his facial spasms, we know that a lot of it's definitely coming from this neck area, especially this occipital area, because eye areas, right? Anytime somebody complains about the eye, that occipital area is going to be a big thing, right? Headache that radiates all the way around here, the occipital neuralgia or occipital types of headaches, and they can be some of the worst. So we want to make sure that it's getting better.
Sounds good. Sounds good.
So look to the right. Go slow. There you go. Does that hurt at all when you're doing that?
No.
No. Okay. So what I'm noticing here, though, Your nose is right here, right? This is about 70 degrees. We want it to be closer to 90 without you having to force it, okay? So you see like you're starting to strain this way?
Yeah.
Look to the left. Yeah, kind of, and I can feel your body shaking once you get there, right?
Yeah.
Look all the way up to the ceiling. Does that hurt at all when you do that?
Yeah.
Yeah? Where do you feel that pain at?
Right here.
Right up there? Okay, look all the way down. Does that hurt at all when you do that too?
No.
No? Okay, look straight. Any back pain at all?
Yes, lower back.
Lower back pain. Let's have you touch your toes for me. Yeah?
So, stiff.
I want you to do this. Stand up, stand back up, take off your shoes. Did you have pain in your back when you went down?
Mostly in my hips. I usually have it in my back, but I think
That helped out.
That helped out.
Good. Try and touch your toes again. You were actually touching your toes. You weren't really quite doing that with the shoes on.
Yeah.
Right? A lot of times what happens, the reason why with the shoes is because that heel is a little bit too elevated. When that heel's too elevated, it pushes up in this way and it makes it tougher. So whenever you let that heel down, it just needs a little bit of time to relax. But whenever you can kind of get down all the way this way, that means that your body is actually opening up a little bit. It gives it a little bit more space in that lower back whenever you take off the shoes.
Okay.
Take off that heel. And keep that left leg straight and lift it up as high as you can. Pain at all when you do that?
It's strained. My lower back is
Right there?
stiff.
Okay, go back down. Do the right side now for me too. Pain when you do that one? That looks easier than the other side. How does it feel comparatively? Which is harder for you?
Yeah, right side a little easier.
Yeah, a little bit easier. Okay, good. So the biggest thing that we're seeing in your lower back, right? It's kind of tough. The thing is with your left leg, it sways out to that left side. This is your back right here, right? Right side, left side. You see how like it shifts over this way? Makes sense. So when this is like moving out this way, you're gonna wanna compensate to actually push inward so this goes outwards. Well, we wanna release this tension that's in there. It's not gonna completely take it back, but it's gonna release tension in there so that way you can actually work on opening this up a little bit more. But I think the biggest reasons why you're having that back pain is really not because of that lower back per se, but a little bit higher into that lower back. And then when we look at your neck, the reason why your neck hurts, the reason why I think you have a lot of those issues is because when we look, this is a normal one, this is yours. What do you notice is the difference between those two?
Mine is too straight.
Yours is very straight, right? So there's no curve whatsoever. It's just straight on. It's pushing over this way, causing you to have a lot of tension here and then down and through here.
Okay.
Too. All right. So what I want to do here, I'm going to feel your neck and see how it is first before we start to move into everything. All right. I just want to see the tension in here. Rigid, huh?
My neck is always.
Feels like rocks in here. It's like I'm pushing up against a 2x4 and it's not really moving. All right, so what we're doing here is opening, gapping some of the joints that have just been compressed for so long. In that upper back, and especially in that upper neck, it just feels compressed. That's why when we're pressing up in through there, there's no movement really whatsoever. All right,
Okay.
So keep your eyes closed, keep your teeth closed, keep your lips closed. We just want you to take in the moment, right? You're here for a reason. Reasons to get better. We're gonna hook underneath this just a little bit more. Put your hands on your stomach for me. That'll be a little easier. Good. Oh, beautiful. That was a lie, huh? You can keep your legs up. You can keep your legs up.
My lower back is hurting just a little bit.
Yeah. We went all the way down.
Yeah. Wow.
We're gonna let your body just kind of process it, allow it to just, because there's a lot of impulse that just kind of went into you, right?
Yeah.
How you doing?
It feels better.
Yeah. Is it calming down a little bit now?
Yeah.
Do you feel some pain still or no?
No.
No. Okay. What do you feel right now?
I'm trying to focus on the pain that used to be in my eyes or behind my eyes, and I definitely feel like there's something different.
Good. Sometimes I think it's so hard to figure out like what's going on. So a lot of times when people are here and they're getting adjusted and we pull and it's like this big shocking effect, sometimes you're like, am I dead or am I good?
It was,
and I think
it was shocking.
Yeah.
I was expecting, I don't know, I was expecting that you were gonna like do it slowly or something.
Yeah.
But you're right. It's a shock. But now that calmed down, I definitely feel I'm excited for what's next.
Let's go. And then let's try this again, okay? Turn your head all the way to the right again. How does that feel this time?
Definitely better.
Yeah, look to the left now. That's way better already.
It's way better, but I'm noticing that this side is stiffer for some reason.
That's okay. So whenever we pulled, right, your body's still kind of relaxing everything. We're gonna go and clean up a little bit, but I can feel, so right in through his traps, in through here, it's just so tight. Doesn't always feel the greatest. To help move.
Wow. Ooh.
Yeah.
There was a nerve.
All the way down, right?
Yeah.
Good. Look straight again, you ready? Look to the right again. Yes.
Nice.
Left.
Nice.
How's that? A little better?
Not much. Not much on this side.
Okay. It's kind of tough right in through here. So we're gonna push. It's okay. Now look to the left again.
Okay, now this is better.
There you go. Now let's try that again, okay? Lift the left leg up as high as you can go again. Good. How does that feel?
Feels good.
Yeah.
Less strain on my lower back.
Yeah, the other thing that we're seeing is that you're not coming out like this anymore. Go back down, do the right side. Yes, good, about even. So the other thing with his upper back is that this curve comes down like this and through here. So you can actually see it on that x-ray over there. And then it just takes like this S, so it goes like this, goes like that, and then goes straight. So there's a lot of tension on those breaks of those curves, so right in through here. Good. So we're just adjusting the ribs. So you see when I press in here, right, compared to this one, this can actually push inwards. This one like gets stuck right there, right?
Yeah.
Same thing here. This one's a little bit more, but personally, right in through there, I don't like that part. I'm gonna decompress this lower part here first. So we're hugging in, seeing. Good, loosen your neck. Don't help me out. That's good. Nice and jiggly, okay? Jiggle, makes it wiggle. Here. Beautiful.
Oh.
Yeah?
Yeah.
Good. I love your attitude, man. I got the impression whenever he was talking that it was very like grim and dark, but then when he was like, no, I'm very hopeful, you don't see that very often. So
Yeah.
I think that's phenomenal. So the people that do watch this, I hope you guys realize there's always hope for something. You just have to figure out what it is, right?
Exactly.
All right, keep holding on to that, okay? Loosen this hip though. There he goes, one more, good. And then here, there he goes, good. Right in through here, between your thoracolumbar junction, it's rotated and shifted over this way.
Okay.
So we're unrotating it and trying to push it off. That way.
That's where my lower back problems is.
Exactly, so this is where lower back problems are coming from. Good, now lift this one back up again. Even easier, right?
Yeah.
And right side? Yeah. Okay. So we are going to open up that mid back just a little bit more and slouch your entire body. Good. Right there. Feel that there? Mm-hmm. We're going to roll back. So this part and is up, well, really mid back. It's just causing, so we're going to shift a little bit this way.
Can you hear the pop?
Yeah, I already heard it. Lay all the way down, head back. All the way. Let the shoulders come down now. Oh, wow. Yeah.
I like that smile.
That's good.
Not so tight, not so tight. Loosen. Good. Close your eyes. Yep. There it is. Yeah?
Nice.
Feeling good?
Definitely. That felt like exactly the point where there's a lot of trigger points.
Mm-hmm. So trigger points, right? So people that are like, oh, I'm trying to get rid of these trigger points and whatnot, they come because your body is trying to protect a certain area. That's why they're trigger points. And it just, there's an abnormal pattern, then your body is like, well, let me kind of tense it up right there. So releasing the trigger points is one thing, but the source of it really comes from internally, this way. L2 right there. Feel this here? Let's, oh, there it goes. So L2 is a little different. We're having to really roll him all the way this way. Close your eyes, man. Breathe though. Good. Oh. Beautiful.
Can I sleep here?
Yeah, you can. Let me get a blanket real quick for you. So right in here, that's better. Good. Beautiful. Wow.
Yeah. Getting there.
We're getting there, right?
Yeah.
How's everything feeling on you so far, man?
Much better.
Yeah?
It's confirming what I've been talking to my father about. He's mentioning that it's muscles or some sort of nerves getting compressed.
Yeah. So you're saying your dad knows some things?
Yeah, he does. He does. So
Smart
just relieving different parts of my body and just feeling better.
Yeah.
Is just confirming that this could be it, or this is most probably it.
Sure. No, that's great. Even just that, right, the confirmation of knowing something is huge. Like a part of hope is finding the answer as to why you're having your issues. So the fact that you're able to find your issues and figure that all out is
honestly
phenomenal.
one of my biggest problems that I had is like continuously asking what is the reason, like what's causing it, because there's a lot of different theories.
Yeah.
Migraines are a little bit different than, oh, there's something wrong in the muscles. Neurologists give you different routes or different types of solutions than if it's a muscle problem and relaxing the muscles. So just feeling like getting better while my body is getting aligned and tension is less in different parts, making me feel like we're getting closer to the root cause.
Absolutely. I think with anybody, right, whenever you have issues, whenever you have pains, whatever it might be, when you look to the source of everything, where your body stems from, like its power source is your brain. The brain, that spinal cord. So when you look into that first and you see the thing that's protecting it, if that thing protecting it is off, then obviously the thing inside of it's going to be off. So that's what we're trying to do, is restore that motion in between those joints and those segments and allow your body to process what it needs to process again, so it can actually feel good the way it's supposed to. When I first pressed this on you earlier, remember how tight this was?
Yeah.
So right now there's not as much tightness anymore. That means that your body's finally relaxing the way that it needs to be.
Sounds good. That's amazing.
Yeah. So look down for me first. Now turn your head slowly to the right and turn your head to the left. A little weirder that way, yeah? So we can see that his head is kind of shifted this way too, so we know that a part of this, I can feel it. It's a little different. Yeah, you can feel that right there, right? So I'm just doing this. Open your mouth for me and close it. Good. Open and close it. Good. So this atlas is a little bit anterior, so migraines, headaches pretty much every day. Today was a bad day.
Yes.
Facial twitches, if you guys saw the video, pretty rough. And that right side was even worse. So what we're noticing is that there's a shift that's going this way here in this anterior portion, so that's where we're gonna adjust. All right, so I'm gonna take this right here. Make sure I'm right on it, good. And you can feel that when I press right there. It's a little awkward. So we're doing this first because I want you to feel this motion and this movement and where this is supposed to be. So when you feel like this, you feel that? Right? There it goes. Wow. That was good.
Yeah. I was a little nervous, to be honest.
No, I could feel it. I could feel it. But that's why I was guiding you through those motions.
Yeah.
That was a big one.
It was. Amazing. I don't know if you see it. There's a little bit of it now.
That's okay.
Yeah. Even though the pain behind my eyes is a little less.
Yeah.
But.
So it's okay, right? So the reason why it might start happening, because we just aggravated it a little bit, right? We shifted something. And so with that shift, there comes some things that happen with it.
Makes sense. It got agitated.
Yeah.
Yeah.
But it got agitated, but we are really doing it in the correct way.
That makes sense. That makes sense.
How long do these symptoms normally last for you?
Sometimes like 20 minutes, 15 minutes. So it does last for sometimes. Sometimes they just go away.
Okay.
Sometimes if I shift my focus to something else, it goes away sometimes. But definitely I notice that if I'm still, I'm not doing anything, it just gets worse.
Okay.
Yeah.
So this part in here, I just want to see something. Okay. This one. See how like it gets kind of stuck right there?
Yeah.
So that's the next part. Oh yeah, right in there. Good.
Oh. Oh.
Yeah. Do you crack your neck at all?
Yes.
Okay. I want you to stop that, okay? Because the thing is, when you do it yourself, you're jamming into a bad joint, right? And you're creating a callus on a joint that's not supposed to have it. So you actually restrict your movement even more by doing it.
Interesting.
All right. Lift your head all the way up and down. I want you to close your eyes for me. Deep breath in. Exhale out. That's good. Just bring your hands up a little bit this time. Up higher. There you go. Right there, right there.
Oh. Wow. Wow. My son, when he's really amazed of something, he just keeps saying, wow, wow, wow. I feel him now.
But did he get it from you?
I'm getting it from him at this point. It's been a tough day today, honestly. And this is just a quick break. Hopefully it lasts.
It will. As long as you lay on that block, okay?
Sounds good.
Ready?
Thank you so much.
Yeah, look all the way up. That's giving that curve, right? That's why it feels good.
Oh my God.
Look straight again. Look all the way to the right. That's 100%. Left. Yeah. Stand up now for me too. Let's try and touch the toes also.
Oh my God.
Easy.
Yeah.
How you feeling, man?
So much better.
Good.
So much better.
What changes are you noticing compared to when you first came in?
Way less stiffness, especially in the neck.
Good. You look dazed. Are you dazed?
The pressure behind my eyes is not the same.
Good.
Definitely way less. And honestly, right now I feel much better. Yeah.
Let's go.